A very good afternoon to my guide, my mentor, my inspiration, Professor Dr. Durusha. A very warm welcome to Super 6 candidates and contestants of our grand finale PCOS quiz. I congratulate you for coming till here, and I hope that you have a very good day today. So I'm Dr. Sabahat. I'll be moderating the quiz for you today. I'm sure you all are prepped up, you are good to go. So before we have the quiz rules and regulations, we will have the PCOS Society of India President's message for all of you and for our viewers as well. Over to you, ma'am.
Thank you very much, Sabah, for your warm words, and welcome everyone to the grand finale of our quiz, which is being held today. I just want to give a little background to this whole quiz. We started way back in about December or Jan this year to try thinking of what we can do for our youngsters so that they start reading more about PCOS. I'm not sure there's too much of a chapter knowledge in the postgraduate books, which they may have come in now, but I'm sure it wasn't there maybe 10 years ago. So I said the best way to do it, and we've done it in our organizations also, that we must have something like a quiz, which makes young people read on the subject and understand what PCOS is about. And so we started the PCOS quizzes in about March 2021, and we continued it till August 2021. Actually, I think we started March 2020, and we continued it for about 6 months or so. And every weekend we used to have a quiz with multiple choice questions. And honestly, it was a real way of living or understanding the knowledge. So you have a multiple choice questions and you answer and you get a score. And if you've got your answer wrong, you actually get the correct answer given to you as information which you learn. So it became a learning app sort of thing, wherein you learned what you were doing right and what you were doing wrong. So this is something which we need to understand as to how it started. And we continued it till a few months ago. And every month, the delegates who appeared for the quiz were actually, getting an Amazon coupon at the end of the month. So we had more than 400 participants in this program, and it did very well. Then we stopped it for a while and we started working towards a grand finale. And why did we think of the grand finale is because we felt it should be something fantastic, which everyone notices, and that's where excellence will be honored, will be given a great tribute. So we have decided to do this like a KBC style, Kaun Banega Crorepati style. And I must thank the Docplexus team who have worked very hard over the last 2 weeks trying to work on a scenario which will give us the same effect as we see on TV. So you girls are going to be the stars of that day, and I'm glad that you are all 6 finalists coming up to contest for huge prizes. The first prize is ₹1 lakh, the second prize is 75,000, and the third prize is 15,000. For the contestants who unfortunately don't make it to get that prize, but yes, we have reached to the top 6, so the Super 6 as Sabah calls it, we will have a consolation prize for all of you. So this is what I wanted to tell you about why we did this and the reason behind, why we are doing it in a grand style today. I must thank, Sabah for moderating this session, and I must thank Dr. Madhuri Patil, who's been helping us also with the questions. We did the first elimination round, wherein we identified the top 30 into the second elimination round. In the second elimination round, we got, out of those second elimination round, we have got the 6 of you who are actually, when we did the quizzes earlier, we had a team. We had Dr. Sarita Balirao and Dr. Sujata Kar, who helped to check whether daily the quizzes, the questions and answers which came in were good, were correct, etc. and they were supervising or sort of checking what others had sent as quizzes. So we did a huge team to do that for the 6 months that we did it for. Now, one more thing I wanted to tell you is that this particular program has been supported by the Sun Pharma and Inca Science, and they have actually supported this entire event, and they are our sole sponsors. So we thank them immensely for supporting us in this endeavor, and we also thank all those who have helped us otherwise in terms of, we have the people who are behind it are of course, the Docplexus, as I told you, who have supported us with this team, with this platform. And we also have our PCOS Society team, which consists of Finali and Rochelle, who have been helping us. And at the same time, we thank all those members of the Managing Committee of PCOS Society who have been helping us. So thank you very much, Sabha, for taking up this program so well, and I'm sure at the end of it we'll have the winners, and we look forward to going through this quiz in a grand way, and all the best to all 6 of you.
Thank you very much, ma'am.
Thank you.
Okay, I hope all of you have got the rules and regulations of the quiz. So what I'll be doing, we have a total of 3 rounds. And I'll be telling you the rules and regulations for each and every round at the start of the round as well, so that there is no confusion. Okay, I would just quickly tell you, it's Dr. Akriti, followed by Dr. Chandana, Dr. Garima, followed by Dr. Kavitha, then Dr. Mangala and Dr. Nidhi. So we'll be starting with the round 1 of the quiz. So there will be 3 questions. So what we have done is we have split round 1 into round 1A and round 1B. In round 1A, we're going to have 3 questions per candidate, and the total time, including the asking of the question and the answer, will be around 1.5 minutes. So you will get +10 for correct answer, and if you answer it wrong, you're going to get a negative mark of -5. There is no passing of questions in any of the rounds. Is that clear?
Yes, ma'am.
Here we start with round 1A. The first question goes to Dr. Akriti. What is the evidence for genetic basis of Polycystic Ovary Syndrome? Is there familial clustering of cases? Is there concordance greater in identical than in non-identical twin pairs, estimated at around 79% with genetic influence and 21% environmental? Hereditability of endocrine and metabolic features. Mode of inheritance is uncertain. However, it is more likely to be oligogenic or polygenic, like type 2 diabetes. Or is it all of the above?
All of the above.
Okay, the answer is correct. All of the above. The question for Dr. Chandana. Why was this LH and FSH ratio excluded from NIH 2012 criteria? Is it because many women with functional hypothalamic amenorrhea have elevated LH to FSH ratio? Is it because they have high intercycle variability, or there are no specific assays that are available, or is it that normal LH and FSH ratio is also seen in lean PCOS women?
Ma'am, it's A. Many women with functional hypothalamic amenorrhea have elevated LH to FSH ratio.
Correct answer. So the next question is for Dr. Garima. What is the LH pulse frequency in PCOS? Is it 1 pulse per hour? Is it 10 pulses per hour? Is it 3 pulses per hour? Or is it 50 pulses per hour?
And 1 pulse per hour.
That is the correct answer. So let's go to the racial risk for having PCOS. Which among these races is a high risk for PCOS just based on race? Is it African American? Is not a high risk for PCOS. Is it African Americans, Afro-Brazilians, Black Hispanics, or Chinese?
Chinese.
Correct answer. Which of the following, this is for Dr. Mangala, which of the following statements is true about PCOS? There is a preferential production of LH. There is a preferential production of FSH. Elevated LH to FSH levels are seen in around 90% PCOS patients, or all of the above.
There is preferential production of LH.
Correct answer. Hyperandrogenemia in PCOS is due to dysfunction of which of these organs? This is for Dr. Nidhi. Is it liver and pancreas? Is it ovaries? Is it pituitary? Is it hypothalamus? Or is it all of these?
Ovaries, ma'am.
That's a wrong answer because hyperandrogenemia is because of dysfunction of all of these organs. Now, this next question is again for Dr. Akriti. So the time starts now. The LH pulse frequency in PCOS women is same as late follicular phase pulse frequency in normal ovulating women, early follicular phase pulse frequency in normal ovulating women, or the LH pulse frequency of PCOS is not seen in normal ovulatory women.
C, not seen in normal women.
Okay, that's a wrong answer because the frequency is same as that is seen in the late follicular phase when they are peri-ovulatory. So in PCOS, the frequency remains static throughout the cycle. However, in normal ovulatory women, the LH pulse frequency, which is 1 pulse per hour, will be seen in the late follicular phase. The next question is meant for Dr. Chandana. What percentage of PCOS patients exhibit impaired glucose tolerance? Is it 75 to 85? Is it 35 to 40? Is it 20 to 25? Or is it 7 to 10%?
35 to 40.
That's the correct answer. So next question is meant for Dr. Garima, please. Which is the correct statement among the following regarding PCOS? Insulin resistance stems from a post-binding abnormality. 40 to 45% of lean PCOS are insulin resistant. High LH contributes to decreased insulin sensitivity. Both A and B are correct.
Ma'am, is D answer A and B?
That's a wrong answer because only around 25 to 20 to 25% of lean PCOS are insulin resistant in the beginning. So the only correct answer is insulin resistance stems from a post-binding abnormality. So next question is meant for Dr. Kavitha. When is an ultrasound diagnosis for polycystic ovary morphology advised for adolescents? Is it after a minimum of 2 years post-puberty? Is it a minimum of 4 years post-puberty? Is it 8 years after puberty? Or is it as soon as you suspect a diagnosis?
It is 8 years after puberty.
Correct. And that's because, the ovaries take around 8 years. Hypothalamic pituitary ovarian axis takes around 2 to 3 years to kind of normalize and to mature. But we can see that ultrasound morphology, where you see many follicles and you see a high antral follicle count, that can be seen up till 8 years post-puberty. That's why the international guidelines suggest that for adolescents, you should not use an ultrasound diagnosis of PCOM at least for 8 years after they have puberty. Correct answer. So next question is for Dr. Mangala.
Yes, ma'am.
Which of the following medications does not cause hirsutism? Is it danazol? Is it rezapine? Is it methyl dopa? Or is it none of the above?
Rezapine.
Okay, I don't think that's the correct answer. Correct answer is none of these does not cause, means all of these medications cause hirsutism. Danazol, rezapine is an antihypertensive. Again, it causes hirsutism, and methyl dopa also causes hirsutism. So that will be -5 for this wrong answer. Dr. Nidhi, choose the incorrect statement. Electrolysis is a form of epilation. Removal of hair shaft above surface is called depilation. Shaving is a form of epilation. And waxing is a form of epilation.
Shaving off is a form of epilation.
That's the correct statement or incorrect?
Just me.
Sorry?
Shaving is a form of epilation. This is incorrect. Rest of things.
Okay. So the difference between epilation and depilation is that epilation means to remove the hair follicle from under the skin surface as well. While as depilation is you just depilate it from above the skin surface. So this is incorrect because shaving is actually a form of depilation. Correct answer. So next question is meant for Dr. Akriti. Which of the following is not approved by US FDA for treatment of hirsutism in PCOS? Is it spironolactone? Is it finasteride? It is both of the above, or it is none of the above? You guys also have an option of not answering. In that case, you will not get a negative mark if you are wrong.
Ma'am, I'll not answer.
The correct answer is spironolactone. Though it is used right, left, and center for treatment of hirsutism in PCOS, it actually is not approved by US FDA. So next question will be for Dr. Chandana. Which of the following statements is true regarding hirsutism in PCOS? Please see the answers very carefully. Both testosterone and dihydrotestosterone convert vellus hair to terminal hair, and this process is irreversible. Now, conversion happens only in androgen-sensitive areas. Concentration of hair follicles per unit area does not differ between men and women. Both A and B are correct, or A, B, and C, all three are correct.
Ma'am, D.
That's not the correct answer. So both testosterone and dihydrotestosterone, they convert vellus hair to terminal hair, and it is irreversible. And I think all of you got confused because of this concentration of hair follicles. Actually speaking, hair follicles per unit area do not differ between men and women. Okay, it's only because of the sensitivity that they have more of hair growth. Okay, so next question will be for Garima, right?
Yes, ma'am.
The pathogenesis of acne vulgaris in PCOS. Please mark my question. Pathogenesis of acne vulgaris in PCOS includes all except hyperkeratosis, Propionibacterium acnes, inflammation, sebum production, none of the above.
None of the above.
That's the correct answer, because all these actually are related to the acne vulgaris in PCOS. So next question, effect of high serum androgen levels on endometrium in PCOS results in suppression of alpha V beta 3 integrin in the endometrium, decreased production of glycodelin, none of the above, or both of the above. Carefully.
I won't answer this question. I am not aware.
Okay, so it's both of the above. Okay, it suppresses alpha V beta 3 integrin in the endometrium and causes decreased production of glycodelin. So next question is for Dr. Mangala. Which statement is correct about the androgen effect on the endometrium? Is it androgens counteract estrogen? Is it androgens cause atrophic endometrium? Is it androgens cause amenorrhea? Is it both A and C, or is it all of the above? You have to choose the correct statement. No, you're not taking the question? Can you see the question?
Ma'am.
Can you hear me?
Yes, yes, ma'am, I can hear you. Ma'am, I don't take this question.
Okay. So androgens do counteract estrogen. They also cause atrophic endometrium. That's why if there is prolonged hyperandrogenemia, they will thin out the endometrium to the level that they can cause amenorrhea. So therefore, all of these statements are correct. Next question. Very high AMH levels cause poor follicular response in PCOS due to decreased sensitivity to FSH or inhibitory effect on aromatase enzyme, none of the above, or both of the above?
Both of the above.
Sure.
Both of the above.
Should I lock it?
Yes, ma'am.
Okay, correct. So that's the end of your round one. So now all work and no play makes Jack a dull boy, but I think all work and no play also makes Jane a dull girl. So let's see how good you guys are with movie quiz. So this is for Akriti. Can you guess this iconic movie?
Sholay.
Correct. Next question for Chandana. This iconic movie? There are no marks. There are no plus or minus marks for this round.
I'm not aware, ma'am.
So please go ahead and take the question.
I'm not aware, ma'am.
That is Madhubala posing as a sculpture in Mughal Azam.
Okay, ma'am.
Okay, so the movie was Mughal Azam. So next will be to Garima. Guess the movie.
Joker. The Joker.
Correct. Can you tell me something about this movie? Something extraordinary?
I think this is the newer one. He won the original one. He post death. Heath Ledger won the Oscars post death. I think, but this is the newer one.
So this is the new one. It was released in 2019, and it had 11 Academy Award nominations. And it won the best movie, best director, and the best actor in a lead role.
Yes.
Can you see this? Can you see the actress, or is this thing blocking that?
Yeah. Pretty woman.
And the actress?
She's a popular one.
She is a pretty woman. So you just did not guess the movie name. You just said that she's a pretty woman.
She is the one from Eat, Love, Eat and Yoga.
Love, Eat and Yoga, I cannot take it like that. You have to tell me her name.
It's Eat, Love and Pray. Julia Roberts.
Julia Roberts. Yeah.
So who answered this?
Ma'am. Extra marks for me.
Who is that?
More
Who
lively.
missed this and who answered it?
I think she's extra lively right now. Oh.
Who is that?
Dr. Nidhi, ma'am.
All right. So that is Julia Roberts from Pretty Woman. All right. This Oscar-winning movie?
Jai Ho.
Sorry?
Jai Ho.
Who is supposed to answer this?
Slumdog Millionaire. I think it's me. Jai Ho.
Slumdog Millionaire.
Slumdog Millionaire, yes.
Jai Ho was a song, my dear. I mean, so that means you actually read up everything about PCOS and you forgot about everything else. Right? So this is Slumdog Millionaire. This movie?
It's Mother India.
Mother India, something with
Okay, so this was the first Indian movie to be nominated for Academy Awards in international film category. So all of you had questions, right?
Yeah.
I think you did very poorly in this movie quiz. You need to do a little bit of reading and little bit of watching of these movies as well. Should we move on to our round 1B? So there will
Yes,
be
ma'am.
2 questions per candidate in this round. It will be similar to your round 1A, except that we have just made it 2 questions per candidate. Plus 10 for correct answer, minus 5 for wrong answer. You can just leave the question unanswered, in which case you're not going to get any marks. And there will be no passing of questions. So you'll get a total of 1.5 minutes per question per candidate. Are we good to go?
Yes, ma'am.
Okay. So the question on screen comes up for Dr. Akriti. Choose the wrong statement. Hyperinsulinemia contributes to obstructive sleep apnea. Hyperinsulinemia stimulates keratinocytes and dermal fibroblasts. Acanthosis nigricans is a reliable marker of insulin resistance, or none of the above.
None of the above.
Correct answer. Next one will be for Dr. Chandana. Choose the correct statement. Acanthosis nigricans is seen with genetic syndromes. Acanthosis nigricans is associated with gastrointestinal malignancies. Topical retinoids can be used to treat acanthosis nigricans. All of these are correct. None of these are correct. Or you can just choose one.
Acanthosis nigricans is seen with genetic syndromes. A.
Okay, I think all of these statements are correct. They are seen with genetic syndromes. You can have malignant acanthosis nigricans, which is seen with gastrointestinal as well as breast malignancies as part of paraneoplastic syndrome. The only difference is acanthosis nigricans is much more generalized, and it may be the first presenting symptom of these malignancies, and it makes the prognosis very, very poor. And topical retinoids are used to treat acanthosis nigricans. That again is a correct statement. So your answer is wrong. Next question, which of these statements is incorrect? Insulin resistance and hyperinsulinemia are the cause of hyperandrogenemia. Obesity in itself can cause a PCOS-like picture. Only obesity. 60% androstenedione is secreted by the adrenals, or none of the above.
C, 60% androstenedione is secreted by the adrenals.
And why is it incorrect?
Ma'am, because it's mostly 60% secreted by the ovaries and the rest 40% is secreted by the adrenals, ma'am. It's opposite.
Correct answer. Who was this?
Garima.
Garima. So this is the correct answer. This is the incorrect answer. So next will be to Dr. Kavitha. More than 50% PCOS women exhibit moderately increased DHEAS levels. 60% of circulating testosterone comes from the ovaries. There is an increased volume of theca cells in PCOS women. Volume. And number 4, all of them are correct.
All of the above.
Correct answer. High rate, next question. High rate of follicular recruitment in PCOS is due to high AFC and AMH, hyperinsulinemia, hyperandrogenemia, or all of the above?
All of the above.
Correct answer. What is the Perman-Galloway scoring for Hirsutism recommended for Far East Asians? Is it more than or equal to 3? Is it more than or equal to 8? Is it more than or equal to 11? Or is it more than or equal to 9?
B, more than 8 or equal to 8.
Oh, that's the wrong answer. It's more than or equal to 3, because for Far East Asians, the hair follicles per unit area of skin are very, very less. So that's why even if they have an FGS scoring of 3 or above, according to latest international evidence-based guidelines, that can be considered as hirsutism. Now, next question will be for Dr. Akriti. What percentage of PCOS women exhibit polymenoria? None of them have polymenoria. Less than 2% have polymenoria. Less than 20% have polymenoria. Or 7% will have polymenoria.
B, less than 2%.
That's the correct answer. Plus 10 for this. Next question for Dr. Chandana. Androgen enhances, you have to choose the correct statement. Androgen enhances steroidogenesis. There is a negative correlation between androgens and glycodelin. Androstenedione causes dose-dependent reduction in endometrial proliferation. All of the above. Would you like me to read it to you again?
Yes, ma'am, please.
Androgen enhances ovarian steroidogenesis. There is a negative correlation between androgens and glycodelin. Androstenedione causes dose-dependent reduction in endometrial proliferation, or all of the above. So the correct answer is all of these statements are correct.
Yes.
The cumulative, next question, cumulative pregnancy rate with clomiphene citrate after 6 months of therapy is 20 to 30%, 40 to 50%, 25 to 35%, and less than 10%.
That's 40 to 50%.
That is the correct answer, plus 10 for that. Kavitha, the next question is for you. Which among these is a criterion for critical OHSS? Hematocrit more than 55%, WBC is more than 25%, more than 15,000 per cubic millimeter, ovaries more than 5 centimeters in size, or all of the above?
All of the above.
That's the wrong answer. The only criterion which fits for critical OHSS is hematocrit more than 55%. Okay, ovaries more than 5 centimeters would be moderate OHSS, and WBC count more than 15,000 would be severe. Next question. High risk for ovarian hyperstimulation syndrome includes all except asthenic habitus, more than 20 follicles in IVF, serum estradiol levels of more than 1700 picograms per ml in ovulation induction, or none of the above.
And this ovulation induction includes IVF as well, right?
No, ovulation induction does not include IVF.
Asthenic habitus means thin built or?
Asthenic habitus means asthenic habitus.
Thin built, right, ma'am?
I think so.
Asthenic habitus.
Okay, I think that's the wrong answer. If somebody is lean of asthenic habitus, it's a high risk for OHSS. Okay. Okay, and you can have more than 20 follicles in IVF, or serum estradiol of more than 1700 in ovulation induction and more than 4000 in IVF. Next question is on your screen. Which among these statements is a correct statement? Oocytes from PCOS women have reduced developmental competence. Oocytes from PCOS develop premature granulosa cell luteinization. Intrafollicular testosterone levels are increased in PCOS patients, or all of the above.
Ma'am, all of the above.
That's the correct answer. That is the end of round 1. So are you all relaxing? Are you enjoying this?
Yes, ma'am.
Yes.
Yes, ma'am.
So let's proceed to round 2. It's a visual round. 1 question per candidate, half a minute to answer, including the question. I mean, there isn't much to ask. There's just a picture, and you have to guess the picture. And then there will be +5 for right answer, -2 for wrong answer. There's no passing of questions, and you can just, choose not to answer. Akriti, start the time, please. Akriti, can you identify this?
Ma'am, there'll be no options.
No. It's a visual round, my dear.
Oh, ma'am, I don't know.
Okay, that, my dear, is a pigtail catheter. So that's what we use in ovarian hyperstimulation syndrome if we have to drain ascites or pleural effusion. Okay, so that's how it is connected to PCOS. Now, the next question is for Dr. Chandana. Chandana, your
Yes,
picture
ma'am.
will be on the screen. Can you diagnose this?
Chondrocams,
Sorry?
the skin tags,
No, what is the name?
acrocondyles, skin tags.
No, skin tag is a non-scientific name. You are correct, but you have to tell me the scientific name.
Ma'am, acrocondys. Acrochondron.
Acrocordons.
Yes, ma'am.
So I don't think we'll give you a negative mark for that, but you did not know the exact name because you just said everything other than acrocordons. It is acrocordons. Skin tags is correct, but skin tags is a non-scientific name. So these are markers of insulin resistance. Okay.
Resistance.
So these are not only seen in PCOS. These can be seen in other insulin resistant states as well. Mostly diabetes.
Ma'am,
or
I said
pre-diabetes.
acrocondons. I think
So
I said
you said acrocondons. Condons. No, this is acrocordons. Okay.
Okay.
So next question will be for Dr. Garima. What do you see in the picture?
Ma'am, ovarian wedge resection.
Correct answer. You get the +5 for this. Next question will be for Kavitha.
This is the therapy for obstructive sleep apnea.
So what is it called?
It's a monitoring, sleep apnea monitoring. They monitor and then oxygen therapy is given.
So my dear, there's a specific name. It's a CPAP. It's a CPAP. Okay. So she does not get any wrong. She does not get any minus for this. She doesn't get any plus points also. Okay.
Yeah.
So she's at 0.
0.
X is for you, Dr. Mangala.
Yes, ma'am.
Can you name the pattern of lower abdominal hair distribution? What is the name for this pattern? It's an inverted triangle for a female. It's an upward pointed triangle for a male. It's a little difficult, but that's by chance that you got this question. Okay, not that I'm going to give marks to anybody. Once her time is over, I would like to see if any of you know about this. If you do, please let me know.
It is inverted V is acuminate. Acuminate.
Ma'am, give options, then we can say, I guess.
Ma'am,
No.
eustachian.
You just have to name this.
Yes.
What is this pattern called?
Eustachian.
Eustachian
Something like
tube.
that. Yes, something with EU only, something like that, I guess.
So it's called escutcheon. It's a
Something with
little
E, yeah.
difficult to pronounce. So it is escutcheon. Okay, so this pattern of hair distribution in females and males is called escutcheon. Next question will be for Dr. Nidhi. Name the scoring system. Now this is an easy one.
Ma'am, I know this.
I'm sure you know it, but I need to hear that.
No, Mangala here. I know this one.
No, my dear, we cannot go backwards.
I wish I had got this question.
No, please, let
No,
30
ma'am, I'm
minutes.
not answering.
No, ma'am, I'll not take this.
Okay. So, Mangala, tell me, what was this?
Ludwig score, ma'am. Ludwig visual score for
Yeah, it's a
alopecia.
three grade Ludwig visual scoring for androgenic alopecia, for female pattern baldness. So nobody gets any marks for this. Yeah, so nobody gets any marks for this question. So that is the end of your visual round. Visual round. So next we are going to rapid fire round, in which you have to reply in a yes or a no. That's all. There will be 5 questions per candidate, and I'll ask those questions in one go. So that means candidate 1 will have all her 5 questions in one go, and then we will proceed to the next candidate. Is that okay?
Yes, ma'am.
The total time will be 3 minutes per candidate. So you will get a +5 if you get all 5 correct. So basically 1 marks, 1 + 1 for correct answer, and no negative marks in this rapid fire. Is that okay?
Yes, ma'am.
All the best to all of you. This is your final round. So the final countdown actually has begun. Good luck. So this is for Dr. Akriti. So KIS1 gene is a tumor suppressor gene. Yes or no?
Yes, ma'am.
Next question. Protracted metformin treatment reduces AMH levels.
No.
Obesity, independent of insulin resistance, reduces oocyte number. That means obese females who do not have any kind of insulin resistance will still have reduced oocytes.
Reduce oocyte on IVF procedure
Yeah,
like that.
absolutely.
Correct.
Abnormal granulosa cell function results in abnormal responsiveness to insulin despite peripheral insulin resistance. Quick, please. OHSS can occur in hypoestrogenic, hypogonadotropic, hypogonadic patients.
Yeah, correct.
Next is Dr. Chandana. Chandana,
Yes, ma'am.
are you ready?
Yes, ma'am.
Okay. So here is your first question.
Estradiol more than 1000 picograms is a risk factor for OHSS in ovulation induction. False.
So you said first false. Next question is ovarian hyperthecosis is a severe form of PCOS.
True.
Third question is 40% of testosterone comes from peripheral conversion of androstenedione into testosterone. Correct or not correct?
True.
Okay. Abnormal granulosa cell function results only in high estrogen levels during stimulation. True or not true?
Normal granulosa cell function results only in high estrogenic level. False. Spironolactone can cause intermenstrual bleeding. False.
Okay, thank you, Chandana, and all the best. Next on screen, the questions will be for Dr. Garima. Garima,
Yes, ma'am.
please come in, and all the best.
Thank you, ma'am.
Dihydrotestosterone. Can you read it for me? Because my
Dihydrotestosterone is more effective than testosterone. True.
South Asian women
South-
are more severely symptomatic compared to Caucasian counterparts. Symptoms. So first one you answered true. Second one, late OHSS accounts for 70%.
Ma'am, false. Second for false. Ma'am, false. Second for false.
Okay. Late OHSS accounts for more than 70% of severe OHSS cases.
True.
True or false?
True.
True. LH dysregulation is responsible for uncoupling of hypothalamic E2 inhibition. True or false?
True, ma'am.
Paracentesis should be more aggressively done if hemodynamic stability is lost in a patient of OHSS. Is that correct or incorrect?
False. Thank you, ma'am.
Garima,
Yes, ma'am. Thank you so much.
all the best and thank you very much. Okay. Next we have Dr. Kavitha. Kavitha, please come in.
Yeah.
Kavitha?
Yeah, I can.
Okay. So first question for you, my dear, is controlled ovarian stimulation rescues oocytes that are intrinsically abnormal and meant to be atretic.
False.
False. Recombinant LH has a half-life of 20 minutes. Is that correct?
It is false.
Metformin reduces serum testosterone levels.
True.
LH dysregulation is a primary event in PCOS women. True or false?
It is true.
Flutamide is a 5-alpha reductase inhibitor. True or false?
False.
Then what is a 5-alpha reductase inhibitor?
Finasteride.
What is flutamide?
Finasteride is a 5-alpha reductase. Yes,
Thank you, Kavitha, and all the best for the final scores. Mangala next.
Yes, ma'am.
Mangala, you ready?
Yes, ma'am.
So here comes your first question. OHSS can occur in spontaneously occurring singleton pregnancies. Is that true or false?
Next question, ma'am.
Okay. There is a positive correlation between testosterone and number of antral follicles. True or false?
False.
Third question is on the screen. VEGF antiserum can reverse VEGF-induced ovarian hyperstimulation.
True.
Have you heard about a VEGF antiserum?
No.
Then this is just your guesswork,
Yes.
because there are no negative marks. Okay. Abnormal granulosa cell function is associated with increased VEGF levels and also the increased vascularity of ovaries. Is that true or
True.
false? Okay. Last question. Controlled ovarian stimulation only can result in ovarian hyperstimulation without affecting the fetus with multiple birth defects, imprinting, and epigenetic disorders. Is that true or false?
True. First one, it is very, very rare, ma'am, but since it is given can occur.
So you have to tell me true or false.
True.
True. So here are her
Ma'am, second one, positive correlation means with increasing testosterone, there will be a decreased antral follicles. If positive correlation, I don't know the meaning of positive correlation, whether it means increased testosterone, increased antral follicles, it's a no. If it is, there is testosterone.
No, I mean, you have to understand the question. I mean, positive correlation is a scientific term, right? So that
then
I
it
leave.
is false, ma'am.
So you answered first one true, second. So we're going on to, so we're taking your first as true, second as false, third as true, fourth as true, fifth as true. Thank you, dear Mangala, and all the best to you. Did you enjoy the quiz?
Yes, ma'am.
Okay. Dr. Nidhi, Step-up protocol continuously rescues follicles from atresia. Is that correct?
False.
False. Topical retinoid is recommended for moderate to severe acne. True or false?
True.
Recombinant LH is as effective as HCG for final follicular maturation. Is that true? Recombinant LH as a trigger is as effective as HCG for final follicular maturation.
True.
True?
Come back to this later, ma'am. Please do.
So I'm leaving that blank. Insulin stimulates dermal fibroblast growth.
True.
True. Metabolic syndrome is seen in nearly 75% of women with PCOS. Sorry. Is that true or false?
False. I recombinant LH is for HCG for final follicular maturation. False.
Thank you, Dr. Nidhi, and all the best for your final scores.
Thank you, ma'am.
Did you enjoy the quiz?
Sure.
Any feedback? Any negative points? Any positive points? Would you like to say something?
No, ma'am. Overall concept was very good.
Some questions were pretty amazing, especially the metabolic questions. Some of the newer things were there. Like the testosterone question, I think earlier that you asked, I really started to know that.
Thank you so much. You know, that's why I told you I was more nervous than all of you, because doing this quiz at this level means a lot of reading. You know, my kids have been asking me, Mom, are you going for some exam? I said, yes, kind of. Except that I'm not going to take it. I'm going to make others take it. Anyway, thank you so much, all of you. I think that's the end of the quiz. I had a wonderful time, and I think all of you were brilliant, and that was tremendous amount of reading that you had done. You did really, really well, and all the best to all of you. I think we'll be ready with final scores and announcement of winners, and your prizes will be on your way. Thank you so much for participating. I really had a good time. Thank you.
Thank you so much.
Thank you, ma'am.
I really think I would even like to echo what Dr. Sabah has said, that you ladies have done a great job, and very proud of all of you. You have really done extremely well. And I think I want to, of course, we are waiting for the scores. We really don't know who's first, second, and third. But I'm sure all of you are members of the PCOS Society of India. And if you're not, then you need to become one, and we'll complimentary make you members, because if you're not, we want you as our members. I also want to let you know that we are initiating a youth brigade, and that is where young people, we want them to join the society, so that as active members of the society join, we are going to have 32 seats for the youth brigade. And we want 32 of you interested people in the field of PCOS to come in and help the organization to grow even bigger. And that's exactly what we are looking for. So all of you who have shown this great interest, we would love to have you with us. I would like to use this opportunity to thank Dr. Sabahat for putting in a lot of effort in getting extremely nice questions, very brilliant. And of course, quite a few of them I couldn't answer too. So we are all on the same page. And we must remember that, yes, I think clinical practice makes you understand things much more. And if all of you, put in some research papers, do some kind of clinical research in the Indian context, it will help us a lot to understand what's happening in India, because we have a lot of insulin resistance in our country. And we have a lot of diabetes in our country. And in order to assess how many or what is the prevalence of this problem, we still don't have exact data where the Indian scenario is concerned. There are various studies which have been reported, but each one reports different prevalences. So a huge study has been initiated by the ICMR and we are awaiting those answers. But in the meantime, if each one of you can take up a little project which will be initiated with help of, or related to PCOS, we can sort of probably help you in, helping you with that project in some way to help your research. So that is something which I'm promising you as the president of the PCOS Society of India, and I hope that we can support your research projects. So in time, if we have the scoring already with us, and we can announce the winners and we'll show you the checks, because unfortunately we can't hand over the checks to you, but the checks will reach you at your home by courier. And in the meantime, we will show you the checks on screen for you all to see that you're really getting the check. That's what I would like you to do. So Sabha, would you check whether the scores are ready?
Ma'am, scores are ready. Should I send them to you?
No, go ahead. Just announce.
Okay. So I would like to thank Sun Pharma for this brilliant academic initiative. I think it is very wonderfully done, of course, conceptualized by Dr. Durusha. And I would like to thank ma'am for these ideas and the effort she puts into, putting this all together and making this just so very right. Thank you, ma'am. And I would like to especially thank Penali as well as Rochelle for their support, and Docplexus, because we are so technologically challenged that I wasn't very sure about how we would get this done. So thank you, everybody. Now I would request Dr. Durusha ma'am to kindly present the awards to the winners. We would like to have Dr. Kavitha on screen for the second runner-up. Dr. Kavitha?
Yeah, I am. Yeah.
Ma'am, please present the award for second runner-up.
So congratulations, Kavitha, for the job you've done. And we do hope you participate in our quizzes every year. We hope to do them every year. And I think it's been very encouraging that so many of you have done a great job. I think the Olympics and the Paralympics is bringing out all the women as winners, and I'm so happy that you women have come here. Very good.
I was also saying, I had done your PCOS expert course, so that really helped to actually upgrade the PCOS knowledge in so detail. Otherwise, we haven't read so much in our UG or PG about PCOS. So that was one very good course and module we had, 6 modules of PCOS expert.
We also have 6 modules of the basic course of PCOS online. We also are working on another new course coming up, which will come hopefully in a few months, on nutrition in PCOS. And we are coming up with quite a few things. So watch out for that, and you guys must come in and apply for the youth brigade.
And please do enroll for the conference, the international conference that is scheduled in October. We're going to have a brilliant academic treat. So please do register yourselves, all of you. Okay. So congratulations, Dr. Kavitha. How are you going to enjoy today?
I'm working, going back to work.
That's how you enjoy. So that's what I said. All work and no play makes Jane a dull girl.
Yeah, surely I'll enjoy at the end of the day with my husband and my kids.
Congratulations to all of them. Okay, so next I would like Dr. Akriti, first runner-up. Ma'am, please kindly present the award to her. Very well done, Dr. Akriti.
She
Thank
has
you
been
so much,
very
ma'am.
active. We've got questions from her, which on mail I've been getting, which is shows that she's really involved in the quiz. And during the elimination rounds, there were some issues which she brought to our notice. Thank you so much for that. We will try to get better as the years go by. And congratulations on doing so well, and all the best to you.
Thank you, ma'am. Thank you so much.
Yeah.
Many congratulations.
So prize of 75,000 rupees, which goes into your bank account, and you get a certificate and check from us.
So how are you going to enjoy, Akriti?
Ma'am, currently I'm going back because I had one pickup patient. She's waiting for getting discharged. So I have to go
Well,
and rush back.
they're all workaholics like you.
She's waiting for the discharge. I have to go and write a summary for her and then send her off.
Okay,
First
congratulations, and I feel actually good that you did not have any doubts with these final questions today. Okay, take care. Very well done.
Thank you, ma'am.
So we have the winner of the grand finale PCOS quiz, who has actually topped among the Super 6 contestants. And I proudly announce her name. She's Dr. Garima Gupta.
Thank you so much.
Many congratulations. She's
Thank
an
you so much,
assistant
ma'am.
professor of obstetrics and gynecology at Government Medical College, Kanpur. Is that correct?
Yes, ma'am, it's GSP Medical College, Kanpur. Ganesh
Okay.
Shankar Vidya Medical College. Yeah.
Okay. So that's great. I would request ma'am to present the winner awards and check to you. Many congratulations. Very well done. 3 chairs to you.
Thank you so much.
So this is the PCOS Excellence Award, which you are getting with all 3 of you. And this is an award of 1 lakh rupees, which will come to you as a check, and you will have the certificate to display. And we must again, hope that you will be part of our team and let us grow the PCOS Society together and make it even better. So again, congratulations to you.
Thank you so much.
We do have prizes for the last 3 who are on the Super 6, and we all have also done great. I don't think you also feel disappointed, and we do have a check of 5,000 rupees for each of you, and we would like you to, we will send you certificates, the PCOS Excellence Awards, and we'll send you the check, and we hope that you join us again next year and you join our society and become active members of the same. So congratulations to all of you.
Thank you.
Thank you, ma'am.
So I think we call it a day. Thank you, everybody at Docplexus. Thank you, all our contestants. We had a brilliant day today. I hope you enjoyed. Thank you, Priyanka. Thank you, Darshika. And a big thanks to ma'am.